Good afternoon and welcome to ECHC's April webinar, Finding a Way, Support for Families of Children with Disabilities and Developmental Delays. I'm Erin Augustin, Outreach Specialist with Early Childhood Health Consultation. We're pleased to have you join us today. ECHC is dedicated to supporting Wisconsin early childhood care providers in promoting best health and safety practices. Our vision is a sustainable statewide model focused on the health and well-being of children across the state. The Wisconsin Department of Children and Families and the University of Wisconsin-Madison School of Human Ecology are partnering to offer health consultation services and other educational resources for Wisconsin early childhood care providers. We are grateful for the support of the Preschool Development Grant and the Roots and Wings Foundation. Our mission is to support Wisconsin's early childhood education providers in addressing health-related concerns and offering guidance on best health and safety practices. We acknowledge the American Indian tribal nations across Wisconsin and commit to offering tailored support to meet the needs of each tribal community. Our program provides general guidance on best practices for health and well-being in early childhood settings. For specific child-related questions, please consult the child's primary care medical home. Today's webinar will include introductions, central content, Q&A session, and closing remarks. If you're interested in continuing education credit with the Wisconsin Registry, please enter your information in the post-webinar survey by Monday, April 7th at 5 p.m. The link will be included in the chat at the end of the event. You will also receive a link in a post-webinar email shortly after today's presentation, which will include slides and a recording. Your attendance will be reflected in your Wisconsin Registry portal within 2 weeks of the live event. This will serve as your verification of attendance. Please use the chat feature throughout the webinar to send messages to the host, panelists, or everyone. The Q&A feature is also available for your questions, which can be sent anonymously if you prefer. If you're joining through your cell phone today, see the chat and Q&A functions at the bottom panel. Today's presentation features Meredith Vidioli, Co-Director for Connecting Families at the University of Wisconsin-Madison Weisman Center. She is also the Director of Children's Resource Center South. Now I'd like to turn it over to Dr. Depesh Navsaria for today's featured presentation.
Good afternoon, folks. As always, pleased to have you here, and thank you for taking time out of your days. I'm so excited to hear about an amazing resource today that I've known about, but look forward to hearing so many great details on from Meredith, as you heard, and I will let her take it from here. Meredith, it's all yours.
Thanks so much. Hi, everybody. I figured I'd introduce myself real quickly before I start sharing my slides and kind of get carried away with chatting about my topic. So, hello, I'm Meredith Vidioli. I'm a social worker at the Weisman Center in Madison, and Erin shared a little bit about my roles there. I'm here today to talk to you about Wisconsin Wayfinder, but there are a couple other things that I do at the Weisman Center, co-direct the Connecting Families program, which I'll talk a tiny bit about. And I also support through reflective practice and other things, I support the Weisman Early Childhood Program. And some relevant work history for me, for all of you to know, is that I spent almost 10 years working for Head Start and Early Head Start in Dane County. And that is for sure where my love of all things like related to the under 5 crowd, right? Like the 5 and under kiddos came from. And additionally, I'm endorsed through the Wisconsin Alliance for Infant Mental Health. That endorsement and the continuing education that I did through the capstone certificate program is really important to me, and something that I hold in my work every day. So that's me. All right. Okay. So, our topic for today is Wisconsin Wayfinder, the Children's Resource Network, and a little bit of history about how this came to be. Um, the state was hearing for a while that Wisconsin families that had a child with a developmental concern or an already diagnosed disability needed a better way to get connected, right, to resources, a better way to find the information and supports that they were looking for. And in January of 2022, as the result of some ARPA funds, the state, the Department of Health Services, decided to start implementing this project that at the time was known as the No Wrong Door, supporting kids together. And this was a really interesting process. The state gathered together like a stakeholder group that included families, right, that had a child with a disability from across the state, um, existing organizations that were supporting those children and families, um, other state departments or divisions, and through all of that like discussion and needs assessment, um, etc., Wisconsin Wayfinder was created. Okay. And what resulted was kind of this umbrella network, is how I think of it, Wisconsin Wayfinder, the Children's Resource Network, under which a whole bunch of programs and supports for kids with disabilities um, or delays live. And it kind of helped to bring a bunch of existing work together, and create some improved collaboration, communication, um, all of those types of things. And ugh, I forgot to click the button. Hang on. Hmm. Oh, yeah. It's not going to let me share my sound. Okay, we'll skip it. I
Oh,
have a
sorry
video,
about that.
but I will put it in the chat, and you guys can watch it independently on your own. We have part of the work, right, and the um, effort that went into Wisconsin Wayfinder was to really make everyone aware that it existed. And so we have this neat little promo. We have commercial kind of, right? That exists. I was going to show it to you, but I'll put it in the chat. You can watch it on your own if you want. And I will say um, that outreach and marketing has been really successful. Um, there's a website you can see here through the Department of Health Services. And the other big thing that came from this effort was this statewide 877 Wiskway phone number. So to kind of walk back a little bit, um, the when someone calls that 877 statewide phone number, a human being answers the phone and asks what county the child you're calling about lives in, and then you're directed to your local Children's Resource Center. So I happen to direct and work at Children's Resource Center South, but you can see that there's four other Children's Resource Centers, and together, we cover the whole state. Prior to the launch of Wisconsin Wayfinder, a family or professionals like yourselves would have to look at the map and kind of figure out, like, well, which place am I supposed to call? And now, with the 877 number, it takes the guesswork out of that. So that's been one of the many positives that we've seen. If anyone is familiar with our old name, which was the Regional Centers for Children and Youth with Special Health Care Needs, if you ever heard of that, just know that we are the same people, right? We're the same people doing the same work. We just got this wonderful new name of the Children's Resource Center. It describes what we are in a much more succinct way. So I'm really grateful for that.
Meredith, if
Let's,
I could break in for one moment, could you try
yeah.
the share screen again? I might have fixed it.
Oh, sure. Cool. Cool. Let's see. Ah, yes.
Excellent.
Yay. Thank you. Okay. Everybody gets to see my little, it's just a 3-minute video. Is it working?
Across Wisconsin, more than 235,000 children have special health care needs. Wisconsin Wayfinder Children's Resource Network is a new free service to connect families to the resources their children need.
Many families have said to me, I didn't know what I didn't know about the process of having a child with special health care needs, or specifically a child with medical complexities.
Families don't know what they don't know, and it's by no fault of their own. This system and service landscape is pretty complicated.
As a parent, everything is new. You don't know what questions to ask.
I work for the healthcare system. I have 2 kids, each that have some extra needs. How is it that I'm still so baffled as to where to go? How am I slipping through the cracks? And I think about how much of a difference it would have made those 4 years, if we hadn't been having to try to figure out how we would pay thousands and thousands of dollars out of pocket for things that were covered.
I missed it. Totally missed it. And she lost, a year plus of treatment that could have been given to her. If I had a toll-free number to call, I think that would have helped with the spin out of control. We need to have a source from the Department of Health Services that we can trust.
Wisconsin Wayfinder is a great resource. It's one place to find out about all the information that you need.
Families can call us through the phone, or they can connect to us through the website.
We want to hear from anybody who's supporting any child age 0 to 21 with any disability, special health care need, mental health diagnosis, whatever it is. We listen really closely to what the family is telling us is important to them, or maybe what's really stressful right now, and then offer solutions or ideas or resources that might be able to address those needs.
Asking for help can be very hard, regardless of what culture you're from. But when you are a parent with a child who needs a little bit of help, it's absolutely crucial.
I love my kids so much. I love my family. Call because there's help out there for those kids.
Wisconsin Wayfinder Children's Resource Network, connecting families to the special health care resources their children need. To learn more, visit dhs.wi.gov/WISC-WAY or call us at 877-WISC-WAY.
Okay. Thanks everybody for hanging in there with me. I'm glad we got that to work. I mean, what else should I say, right? Like we just summarized the whole thing. They did a really great job of summarizing like what it is that we do and who we're trying to connect with, and that little 3-minute spot and that dad at the end just always makes me smile. So yeah. Okay. I think in that little promotional spot, it might have mentioned, so we've talked about how to contact us, and I'll promise I will get more into like who should and about what topics. But I think so far the things I want you to know is that there's that the DHS website, right? The statewide website for Wisconsin Wayfinder, the statewide 877 phone number that anyone can call. We'll talk more about that. Um, and um, on the Wisconsin Wayfinder website, there is this online contact us form. This is just a little screenshot of what it looks like. This is also something new that was added to our ability to connect with people as a result of Wisconsin Wayfinder, and it's been hugely popular. As you can imagine, right? Like in an increasingly technologically connected society, I think families aren't always available to pick up the phone and call us during work hours. We've heard from some families that they might be up in the middle of the night with their child that has a delay or a disability. And because of that, it's just a time that they really check things off their to-do list. And so a family or a professional can go to the Wisconsin Wayfinder website and fill out this online contact us form anytime they want. It asks some basic questions, contact information. Is there a good time to call you back? What are you calling about? But it's been a really a nice added feature and a popular one. Okay, now the kind of who do we serve, right? You heard me say it in the promo spot. Through Wisconsin Wayfinder, we are here to support a child of age 0 to 21 with any kind of delay, disability, mental health diagnosis, special health care need, whatever. It really doesn't matter. And this is across the state of Wisconsin for sure. Um, these are examples of diagnoses that children have when their families or extended families or providers are calling about them. But of course, there is so many more. And something for you all to note, this isn't like a criteria, right? There's no requirement. You don't have to check a certain box in order to reach out to Wisconsin Wayfinder about a child. We're asking about that to learn and know, but our services are free and confidential to anyone who calls. So you've heard me talk about it, but in addition to serving and supporting families, extended family, things like that, who is definitely, and that's definitely the group we hear from the most. We are absolutely here for professionals like yourselves, early care and education providers. We hear from lots of people working in schools, right? Teachers or social workers, school psychologists. We hear from medical professionals regularly, primary care providers mostly. Um, we hear from social workers working in the community with families. It really, again, this is not a thing that matters to us. If you are connected or supporting a kiddo with a disability or developmental delay and you're looking for some information and resources that might benefit them, we're happy to talk to you about that. Okay. I mentioned that, so a lot of people are reaching out to us by phone or email or that electronic contact us form, right? And so that is kind of a limit on what we do, right? You know, I always do this, like I'm a human on the other end of the phone. Um, and I had shared my history of being a home visitor, so I'm used to like being able to talk with families face to face and get in their home environment. And so I guess that's to differentiate us from we don't do case management. We have that initial contact with a family. We provide information, resources, whatever we can do, a lot of emotional support. I'll talk more about that. Um, but, and then we do follow up with them after that initial phone call. We want to make sure that they feel like they're on a good track, right? Based on the initial discussion, they've had a chance to reach out to some of the resources. Um, we want to make sure that there's no new questions. Often there is, because once you've had time to kind of think and digest, right, it like opens up a whole new box of questions and wonders. And then the other reason that we follow up is that we want to help navigate any barriers, right? Um, a lot of times I'm hearing from families like, well, I called everybody and nobody called me back. So I might give them some guidance or some suggestions about what they can do with that. Um, Sometimes families are told conflicting pieces of information or messages, right? I might have told them one thing and they might reach out to somebody else who tells them something different. And I want to help them kind of think through or work through that. Um, so we're having an initial contact with a family and we're calling them about a handful of weeks later to follow up and see how things are going. When there is that need for like longer ongoing support or maybe more intensive support, we are absolutely thinking about and looking for ways that we can connect that family to a case management program or anything else that might be supportive to their needs. Um, we aren't case managers, but again, there is no limit on the number of times that a family can call us. Um, this is what we're here for. So we're happy to chat with them. And we actually have a lot of families that call us multiple times, which as a director really warms my heart because I hope and what I think and infer from that is their first interaction with us was positive in some way. We were helpful, we were kind, we were empathetic, whatever it was for that individual family. And so if they call back, I'm glad. I'm glad for that. Um, I think a couple other things just about what we do. We answer calls as we're able, right? Like a live phone call for sure. Um, People leave messages if we're busy, if we're already on the phone with somebody else, and we get back to them within 2 business days. They're often pretty surprised about that. That tells you something, right, about the service landscape for kids with delays and disabilities. When they get a real call back from a human being, they're pretty surprised. With Wisconsin Wayfinder, we kind of have just regular business hours. It's not identical in each children's resource center, but you can expect something like 8 to 4, or 8:30 to 4:30. It is important to know that we aren't a crisis related service. Families that are experiencing some type of crisis should definitely be directed to the other appropriate resources, their county crisis department or 988 or an emergency room or 911 if needed. Um, and each of the children's resource centers have the ability to support families that speak languages other than English. My children's resource center, South, we are primarily English speaking staff. We do have one team member who's bilingual. She speaks English and Spanish. And then we use telephone interpreters for families that have any other language needs. So I'm really glad that we can try and do our best to support families regardless of what their primary language is. Okay, I think those are all my random thoughts on how, who, and calling. So topics. We talk with families about so many different things. Um, Sometimes it's really straightforward, right? What the question is. It might be, I'm looking for swim lessons for my child that has Down syndrome, right? And I need them to be like adaptive or specialized or somebody that can be responsive to that child's needs. You know, the children's resource centers are broken up regionally, so that allows us to focus in and be more knowledgeable about what's happening in each of our regions, right? Give more specific resources and information. If we had to know what we know about the whole state of Wisconsin, that would be a lot. That would be very overwhelming. Um, so some of our questions are really straightforward like that. Some of them, frequently, they are people kind of at the beginning of their journey. And I think about all of you working kind of with younger children or in the early care and education realm, of we get a lot of, I'm worried about my child's development. I'm not sure what to do. Someone told me just to wait and see, and we give them our thoughts as professionals, but really just try and direct them to information and resources that they're looking for, right? So making sure they know what the Birth to Three program is and how to connect. We get questions about where they can take their child for a diagnostic evaluation. A lot of times it's the question of where can I have my child evaluated for autism? Sometimes, for older kids, it's kind of a question of a learning disability, maybe, or a mental health diagnosis. Um, and then, another example, we're talking to a lot of families after their child has received a disability diagnosis, and they've gotten a wonderful list of things to do next or places to reach out to or call from that diagnosing medical provider. But sometimes they just aren't sure where to start. And so we try to kind of help wade through what we know the options are. And that might be a time, right, where we'd talk about a case management program that the child is eligible for, what the support plan, what the intervention plan could look like for that individual child, talk about the different therapy options, those types of things. Um, we talk about health benefits coverage, right? Health insurance coverage for kids with disabilities. We're making sure that they're aware of special education and what the options are there. It's really, really like a wide range of topics. So I gave you the kind of nuts and bolts about how we support families, but I think this is also important to highlight. We find that we spend in about 45 minutes on average with each family that we connect with, right? 45 minutes to an hour. And that involves the initial phone conversation, right? All of that listening and hearing what's hard, what they're looking for, maybe me reading between the lines or offering ideas of my own that the family hadn't brought up yet for their consideration. And then after the phone call is done, we look for those specific supports and resources. Um, as long as it's accessible and preferred by the family, we send them a summary email, right? And by the time we're all done with that, we're easily at 45 minutes, maybe an hour. And this also allows us to kind of unpack really complicated situations with families. Um, it's kind of here on the slide, but if the question is really they're having a hard time with their school and their child's IEP, right? Getting their special education needs met, we're going to really listen to what's going on, ask what things they've tried, not tried. And maybe what we're going to do is take that time to empower the family, right? For them to feel like they can advocate for their child with their local school district or insert any other, support to a kiddo with disability here. Because we've learned that that is an intrinsic part of having a child with a disability is they oftentimes need an advocate. And a lot of times that advocate is their, parent or immediate family member. So we want families to feel like they're capable of playing that role for their child when and if it's needed. Um, I gave the example of like we would talk families through what a support plan or an intervention plan might look like for their kiddo with a disability. And we really try to personalize the information that we give. And that means a lot of things, but one of the big things is we're going to ask questions like, where do you live? How old is your child? What do they have for health insurance, right? Anything we can do to kind of whittle down that list of places to call is absolutely, of value to us and of value to the family. Families have plenty of things on their to-do lists anyway. So if we can help them make best use of their time or streamline their time, we want to do that. It can be, I've learned from families, it can be really overwhelming, and kind of become like a part-time or full-time job. So however we can help with that, we're definitely going to. And I think the other thing that is so important to myself and all of my colleagues that do this work is that we want to listen to the family and acknowledge their experience, right? Oftentimes people call us and they're really mad, or they're really sad. And I get all of those things, right? It is so true for them. And the disability, support system, service system is doing the best that it can, but it is complicated. Families feel like they haven't tried hard enough, that they haven't called enough places, right? Like they're carrying some of these experiences on their own shoulders, and we do our best to let them know that it's not only them that is finding this individual family finding themselves in this situation. It's a phenomenon that we hear from families every week or probably every day. um, so for all of you as professionals, how to refer a family, um, we have brochures that you could reach out to your local children's resource center and ask for physical brochures if you want to have those available to the families that you're in touch with or connected to. We welcome that you call with the family, right? Sometimes just being handed the brochure or the phone number isn't going to meet the family's needs, right? I just got done describing how oftentimes families that have a child with a disability really have a full plate already. And sometimes one more phone call to make is hard. So maybe call with the family, right? Leave a message with them, whatever it might be. At the beginning, I mentioned that we really welcome if you want to call for the family. This can look a couple different ways. We're happy to have a de-identified conversation with you as a professional and share what we know about information and resources. The other way it can look is if you've gotten the family's permission, you can call and leave the voicemail for them, provide the family's name and contact number, and we will follow up with them. The one part that we ask is that you let the family know, right, that you're calling on their behalf and that someone else is going to call them back. We have a much higher success rate of getting people to pick up our phone call when a trusted individual like yourself has told them to expect our call. I think the other thing that I was thinking about, knowing that I was coming to speak with a group of people working in early care and education is um, sometimes a referral to Wisconsin Wayfinder might involve a difficult conversation, right? I'm imagining those of you who are doing developmental screening or assessments, and the results of those screenings or assessments kind of bring up a little flag, right? Or as kind of the child development expert in an individual child's life, you might be the first one to notice some development that is off track or not following a typical trajectory, and um, you might know or you might not know what they should do next, right? Referring a child and a family to their primary doctor is always great, but if they're looking just for an additional conversation, um, it puts you guys maybe in a hard spot sometimes. And I recognize that, and I'm so grateful for all of you that do take the time to build a relationship with a family and their child so that it enables you to have that type of conversation, right? And get them connected with a resource like ours, or whatever next step you and the family decide is appropriate. So, um, thank you for that. And if you refer a family to Wisconsin Wayfinder, the other thing that I'd love to ask of all professionals doing this is to follow up with the family, to ask, how did it go? Did you call? Did you get a call back from somebody? What did you learn? Right? Making sure that they've taken that step, but also just showing your support, right? And maybe there's a resource or a referral I made for the family that they need a little bit of support following through on, or they want to, talk to somebody else and get their insight on if it's a good idea to apply for the Children's Long-Term Support Program, whatever that might be. Okay, I'm going to spend a few minutes talking about this larger network of support that Wisconsin Wayfinder is a part of within the state of Wisconsin. And it's nothing that you guys have to commit to memory. I think it's just kind of interesting to know that, I talked again about that umbrella of Wisconsin Wayfinder. And in addition to all of like the state programs and entities, these are some of the other organizations that fall under the umbrella. And because of our affiliation that you see here in the circle, it makes them very accessible to us at the Children's Resource Centers. And because of that, we're able to provide better support to the families and professionals that reach out to us. Okay, the first one that I just wanted to briefly mention is a different program that I co-direct at the Weissman Center, and it's Connecting Families. And what we're doing, working on building through Connecting Families, is a system of peer-to-peer family support in the state of Wisconsin for families that have a child with special health care needs or a disability. And we've really focused on unmet needs, right? There are lots of excellent parent or family support options for if you have a child with a disability in the state, and we don't want to duplicate any of that. We're kind of looking for those gaps. And when we did our needs assessment, what we found was that there were plenty of gaps, right? But four that we could focus in on, and those are children with hearing differences, Black families, children with complex medical needs, and rural communities, families living in rural communities. So what we've been doing over the past couple years is really focusing on creating group support opportunities for families that fall in those focus areas. And then for each of those focus areas, there's a member of my team that it has the lived experience of being the parent of a child with a hearing difference, who is Black, that has complex medical needs, lives in a rural community. And so those people and parents with the lived experience are the ones helping to kind of create and grow these supports. Well Badger Resource Center. Hopefully, you guys are aware of Well Badger Resource Center. They are a wonderful statewide support for any type of like maternal child health resource. Um, they really focus on women, families, and young children, and they're wanting to make sure that families are connected to the most like fundamental and supportive social or health programs in the state of Wisconsin. So, parenting questions, those types of things, they are really helpful in getting families connected. Family Voices of Wisconsin is another partner of ours. I, as a professional, use their website regularly. They do a really great job of taking complicated information about health coverage and health benefits for children and youth with disabilities and presenting it in a way that's really family friendly. The other thing that they have an emphasis on is advocacy and family leadership, like family training for leadership. So I mentioned before that we try and empower parents to be an advocate for their child. And I think of my colleagues at Family Voices when I am talking to a parent that's clearly ready kind of for the next step in that leadership and advocacy journey. Okay. I think I'm at the end. This is my standard acknowledgement slide. Here is some of the resources that I shared with you all today. There's my contact information and the website for the Children's Resource Center South. And that's it. And you guys will get all of that. And I welcome questions and anything. And I just wrote myself a little note. I forgot to mention one thing. For staff, a lot of the staff that are working at the Children's Resource Centers are parents of children with disabilities, right? They have that lived experience of like having walked this journey, not all of them, but a lot. And I think that is also something unique that, when we're talking to a parent on the phone, somebody else can say, I've been there. I know what that's like and why that's challenging. So that's my only little thing I forgot.
Meredith, thank you so much. That was such a wonderful presentation, and I'm sure you could see the floating little emojis coming up as people were expressing their gratitude and some of the thank yous appearing in the chat as well.
Yeah.
There's a few questions that came in, excuse me, through the Q&A, which I'll give voice to. If a child is already in birth to three and receiving speech therapy, but you feel like, or the questioner is asking it, but I feel they would benefit from other types of therapy, would Wayfinder still be a good resource?
Yes, absolutely. So, that's a great question. And we often hear from families that already have a case manager, or in the case of birth to three, a service coordinator, right? Kind of like a someone they can ask about information and resources. But we're happy to be a second set of information, an additional opinion. So, yeah, that would be wonderful. And the other thing that I think about in that situation is, are there unexplored resources or supports? Like my mind's already kind of like I would ask these following questions. We might uncover something that out of the people in the situation, just nobody thought about it yet, right? Is that family, would they benefit from parent-to-parent peer support or, something of that nature. There's often things we can kind of uncover.
Mhm. Sure. Yeah, I think there's a lot of different opportunities there that aren't merely about those things.
Mhm.
Um, let's see, what cities are the resource centers located in? And it sounds like they're specifically asking about the North.
Okay, so for the Children's Resource Center North, I will admit, especially in our post-COVID life, a lot of us work remotely. I am not in my office right now. But for Children's Resource Center North, it's the person, like the entity that does the work is out of Marathon County, I believe, but they have an office in Wausau and then one a little bit farther north, and then a couple of the people that are on the phone, like myself, live in the Minocqua area and somewhere else.
But I think the takeaway is that it doesn't matter geographically where they're located. They're happy to help you no matter where you are in the state.
Absolutely.
Indeed. Great. Where can we get the brochures you mentioned, excuse me, to share information with families?
Yes. So I can share a link where the electronic ones, or I can even email them. I have the electronic copies
Mhm.
that I can make available to everybody, or maybe as part of the post webinar content.
If you share it with us, we will be happy to send it in the follow-up email so everyone will
Okay.
have access to that. Thank you.
Perfect. And then additionally, like if you're looking for physical copies, I would just encourage you to reach out to your children's resource center. We all have brochures available to us that we can share with partners so that they can get in the hands of families.
Sure. Does Wayfinder help with respite help?
Yes, that is such a smart question, such a popular question. Yes, we would talk families through what their options are to find a respite care provider. I
Yes.
would say finding a respite care provider is challenging. So, um, that's one of those things where a lot of times families have tried all the things, and
Mhm, mhm.
maybe we have some additional nuggets of information to share, but that's a kind of a good example of where we find ourselves oftentimes just validating that the family has tried really hard and tried all the things to secure um, safe, reliable respite care for their child. But
And
yes,
I'm
please call. We'll talk about it.
and I'm seeing a couple of responses, someone affirming that it was challenging for them for sure.
Yeah.
And somebody saying, reminding us that family members can also be, cleared as respite care workers as well. And I think people don't realize that.
Yeah, family members, neighbors, friends over the age of 18. Yep, that can be kind of contracted with an employer like a fiscal agency. Yeah,
Hmm.
use
Excellent.
those people that are already in your life if you can.
Hmm. Yep. There's actually a little technical assistance dialogue going in the chat on exactly all of that. So there we go.
Perfect. Good.
Is Wayfinder a resource for parents who have children with behavioral issues that don't have a diagnosis yet?
Yes, absolutely. Especially young, I mean, children of any age, but I think, a lot of the people attending today are probably working with younger children, younger kiddos. So yes, have them give us a call. We'll talk through what we know. Sometimes the subtext of that discussion is, should I have my child evaluated for something? Right?
Hmm. Hmm.
Sometimes parents aren't sure if they should say that, or there's lots of appropriate like emotions or mixed feelings around saying that. And yeah, we try and create the space for exploring an evaluation, a diagnostic evaluation if it's needed. But a lot of times families are just looking for, if we were to try something ourselves at home. And yeah,
Hmm.
we'll happily talk to them about that. Our colleagues at the Well Badger Resource Center are also a good resource for some of those things that might feel like typical behavioral challenges or typical parenting things that are hard. So I would hold both of us in mind for
Yeah,
situations like that.
sure. What's the age group again for support from Wayfinder?
0 to 21. And this might not apply to a lot of you, but I'll just give a quick explanation because we say it's for kids, right? But we're supporting children through age 21. And that's because in the disability service landscape, there's this transition period from pediatric social service systems and healthcare to adult social service systems. And healthcare, and we want to make sure we're here to support families in the transition of that process. So that's why it's up to age 21.
Yeah, I was just having a conversation with some of my undergraduates today about what do we define as the tail end of pediatrics? And I said, well, it's complicated. So yeah.
Yes, it is. It is so complicated. Yeah.
Another question, there's so many great questions coming in. Are you like CLTS in a way?
Mm,
I think maybe helping people understand how you overlap and how you're different might be useful.
yeah. I think some ways that there's a lot of eligibility criteria to be enrolled in the Children's Long-Term Support Program, CLTS. There is none of that to call us.
Sure.
We have an initial phone call with a family, follow up with them, and then say goodbye, metaphorically. They can always call us. With CLTS, you have an assigned case manager that must have regular contact with you. And that case manager has the role of authorizing the spending of funds, right? Monies to help support a child with a disability. So those are some of the big ways that I think about us being different. What is similar is that we know things about what's going on in our geographic areas to help support children and their families when the child has a disability.
Sure.
I'm a social worker. Some CLTS case managers are social workers. So, yeah.
Indeed, indeed. Um, I saved this one, which was actually our first question, but it could be long or not. Are there any funding issues with all the government cuts that might affect your services? I think we
Right.
can probably say fairly that no one will be left unaffected, irrespective of their direct funding source by the current cuts. But does
Yeah.
this affect you directly?
Yeah. No, and that's such a great question. Currently, we are not affected by anything, which is wonderful. I did flip through briefly my acknowledgement slide at the end, so I will just say, if this resonates with anybody, that funding for Wisconsin Wayfinder and the Children's Resource Centers, right, myself and my colleagues' work, comes from the Department of Health Services, which is funded through the Title V Maternal Child Health Block Grant. So, and there's actually been some requests gone to the state, to Governor Evers, to help sustain some increased funding that we got to launch Wisconsin Wayfinder. So between the state and the federal budget, we'll see what ends up changing. But currently, we are okay.
Good. Glad to hear it.
Yeah.
Um, who might you refer someone to? I'll make this our last question here.
Sure.
If there's people with disabilities that are over 21, what might be an equivalent that you would
Oh,
refer them to?
yeah. Yeah. Oh my gosh. You guys, great questions. I would kind of think of our equivalent as the your county aging and disability resource center. And really, when kids are 17 and a half, we talked about we want to help support them through transitions in life. At 17 and a half, we're encouraging families to reach out to their county aging and disability resource center, because that really is who picks up the adult disability social service support system. So, yeah.
There were Couple more questions. If we did not get to your questions today, please do not hesitate to reach out for a consultation. Email, contact us. We'll give you all that in just a moment. Meredith, thank you so much for just this amazing wealth of information. Just people have just so much deep gratitude for what you shared with us today.
Yeah, thanks for having me.
I'll pass it back over to Erin to close us out.
Thank you, Meredith, and thanks to everyone who participated in today's discussion. As we wrap up, I'd like to highlight the various free services offered by Early Childhood Health Consultation. In addition to webinars like this one, we have a podcast titled Teachers, Toddlers, and Tissues with monthly episodes. Our resource library includes print and video materials on our website, and our health consultation services are available statewide. Our podcast collection now has 25 episodes available on your favorite platforms. Our newest episode is Keeping Teeth Healthy. To contact us, you may use the QR code or phone, email, website, or connect with us on social media. A few logistical reminders. In a moment, we'll include a survey link in the Zoom chat for those interested in registry credit. Click the link and enter your information. Following the event, you'll receive an email with a recording and survey link as well. If you attended the live session and complete the survey, your attendance will be recorded in your online account within 2 weeks. For those watching the recording, check out the DCF Continuing Education log for credit information. Now, please check the Zoom chat for the post-webinar survey link. If you're joining us through your cell phone, you'll find that in the chat at the bottom. And again, if you joined us live, make sure you fill out that post-webinar survey. And if you are watching the recording, you can receive credit through the DCF Continuing Education log. Thank you all for your attention today and for all you do for children and families across Wisconsin. Dr. Nafsari, would you like to offer us any closing thoughts?
I'll just say that to that last or almost last question that we had about funding and all, there indeed are a lot of ripple effects going on right now throughout our communities. Some of you may be affected more directly in terms of Head Start programs. I'm aware of significant chaos there. Others it may be more indirect. You may have parents in your centers that are losing jobs or worried about losing their jobs. We may see other things going on. I just want to say, we're all in this together, and we should try to support one another to the best of our abilities. It was almost 5 years ago, almost to the day that we found ourselves all on Zoom screens looking at each other in this global pandemic and reacting and responding. To a certain extent, this has that same sort of feel. People are working on it. People are trying their best to stand up for all the things that matter and to help people make better policy choices and to push back when poor choices are being made. Please know that, again, we know, our communities know, and we need to make sure our voices are heard, and those who are making these decisions need to hear from all of us, phone calls, emails, etc., about exactly what it does to you, to the families you serve, to your communities, and so forth. So hopefully we will have better days ahead. Thank you so much for everything each and every one of you do. Take care.